All right, I think we have everyone on, so we will go ahead and get started. My usual housekeeping reminder, please make sure that you submit questions via the chat to all panelists so that we can get those to the right person to be able to answer them. And with that, I am going to turn it over to Dr. Trivedi with StationMD.
Hello, can you hear me?
Yes.
Okay, great. Hi, thanks for having me. I just really wanted to take a minute to discuss our solution, our service, and I know there's been some questions about it through some of the participants. And for those of you who know about us and heard my spiel before, I apologize, but I just want to take a few minutes to let people know that we are a waivered covered service and available for individuals that are on the waiver to add to their estate plan. Just to refresh everyone's memory, StationMD is a telehealth service that is available to individuals with disabilities as a resource. Basically, we are there to contact 24 hours a day, 7 days a week with any questions you may have, medical, any concerns. Our physicians are licensed and able to prescribe medications with the goal of treating individuals in their home setting, keeping people out of urgent care, ER whenever necessary, but most importantly, serving as a resource to families, individuals, DSPs, whenever is needed. It's been really well received. We had several hundred calls last month, and I just want to let people know that we transitioned to a waiver service, so the individuals in your care or that want this, simply you need to speak to your service coordinator to add it to the service plan. If you have any questions, you can reach out to us at StationMD or the DMH website. But I wanted to alert this group that we are still there and a presence and a resource for families. Happy to answer any questions. I'll actually put my email in the chat box if anyone has any questions about it. But we're going out and just letting individuals know that this service is still available and as a waiver service. So thank you.
Thank you, Dr. Trivedi. Troy, I am going to pass the controls to you. I believe you have something to share with folks today on connection.
Yeah, thank you, Heike. Okay. Good morning, everyone. Heike, could you just let me know if you guys can see my screen okay?
Yes, we can.
Awesome. Okay. All right. So good morning, everybody. I wanted to just come this morning. Toy Wilde here with the division of the division today. Sorry, it's been a morning. Wanted to come and provide a connection update. So we are in the process of the implementation of connection, the DD case management system. So we are excited. We have made a lot of strides in the last year. So I wanted to kind of come through and just give an update to this group. So the contract amendments, you guys have heard a lot about the contract amendments we were doing and looking at. So our original RFP had a comprehensive coverage of basically our HCBS waiver services. So I wanted to come back through. We officially got through the contract amendment process. Since this contract we use and we apply for and use federal match money, it was kind of a pretty complex process to get the contract amendments through. So we have to not only go through our Office of Administration, Division of Purchasing to add contract amendments and kind of abide by our procurement processes, but then we also have to go through CMS in order to kind of apply and make sure that we can apply our 90-10 funding. Have some really great news that all successfully went through and got passed by both areas in the month of January. So I wanted to come back through and kind of run through what that contract amendments, what enhancements we basically receive from that to be able to apply to the connection system. So without ado, I'm very excited to announce we had 3 contract amendments. So we had contract amendment number 2, number 3, and number 4, which we'll see kind of identified in those different buckets on the screen. So in contract amendment 2, what we really focused on was additional system enhancements. What I would say is most of the things that we focused on in that contract amendment were things that would make it easier to use the system, would make it more functionable, more configurable for the long term for us. So some of those, for example, are like a document compare. So when you're in doing your ISP, if you're doing your annual update, you'll be able to, once we have, I think there's a minimum of two ISPs have to be in the system, and we'll work through the specifics on this. But basically what you can do when you're doing your annual update is it will do basically a document compare on any changes between, you know, last year's and this year's. So there's that document compare feature. We've added rich text editor to basically all of our areas where you're going to write a note. That way you have that enhanced functionality to do the different underlining, highlighting, all those different things. The ISP printing, we have a customized way that we can print out our ISP. It just lends to being much easier that if you needed to print out the ISP, we have an ability to customize that to make it more friendly. So it's not going to print out fields that were not documented on. It will give you basically a holistic view of what was documented and what's applicable to that individual. And then our SSO Active Directory, SSO stands for single sign-on basically. With the connection system, we did have a part of the requirements for us to have single sign-on use for the state. But what we've added is a single sign-on feature for our individuals and families through FEI, so that when they go in, they just have a single source of sign-on. So we're very excited to add that. So Contract Amendment 2, think of it as more of additional enhancements. Those are just a few that I listed, but then it's also contract clarifications that, you know, make our contract more holistic of what we really need to accomplish right now. So for example, one of those was also our CMS certification. So our DD case management system connection will be CMS certified. There is a new process that we do for that. I won't get into specifics. It's very complex, but I wanted to just share in general. The rest of them are basically contract clarification. So wanted to share that kind of transparently, but there was a lot of additional enhancements that will really make the system much more user friendly. So excited about that. Contract Amendment number 3. Like I had mentioned, the original contract really focused on just the HCBS waiver programs. But with Contract Amendment 3, the added huge value of that is being able to add in our additional case management to connection. We'll also be adding in information and referral, any other services that fall into the bucket that are not waiver or kind of not in any of these other categories, we'll be supporting. And then we'll be supporting autism in the system. We'll also be supporting some children's division collaboration in this. The brain injury waiver will also be now supported in the system. And then our Choices for Families voucher payment program will be supported in the system. So we are just now starting the process of gathering requirements on these additional programs and kind of really defining how that looks and feels in the system. So a very big win. So that really pushes the majority of that program management and hopefully the majority of our billing and claims processes into connection from Seymour. So Contract Amendment number 4, this is basically all housed around additional services that we are going to get provided in the contract. So we are going to have additional user acceptance testing and coordination. We want to do a very robust amount of user acceptance testing. So that gives us additional supports from FEI to do a more robust and extends our timeline around user acceptance testing. We will also be having a supported connection billing and claims pilot. So this billing and claims pilot will be doing a test basically between MMIS and our Medicaid billing to basically do a successful pilot of doing the billing between Seymour, MMIS, and connection with a small subset of DD providers to be able to make sure that we ensure that we have a successful transmission and that we get through basically a 60 to 90 day cycle of that billing and claims. We also have additional services around go live transition support. So we are getting extra dedicated resources around go live and our go live transitions. So that will be very helpful for all of us. That way it can help support just the questions and concerns. If we have any major things come up, this just gives us more cushion during that go live transition and more hands on deck. And then the other big thing that came out of Contract Amendment 4 was level 1 help desk for 24 months post go live of connection. So currently what we have right now is we have a tier 1, or it's equatable to level 1 help desk, and then there's a tier 2. In the contract, it originally just specified that FEI, our vendor, would be the tier 2, which is kind of a higher level support. Now FEI will be supporting for the first 24 months post go live of the system a level 1 and level 2, and then they will help us create our level 1 help desk and then transition us to our level 1 help desk post that 24-month period of their support. So at a high level, this is our contract amendments and what we are getting, a lot of great additional adds. We are in the process right now of signing all of the rest of our contract amendments. Basically we've signed the contract amendments, but now it's getting into what's called a change request, where we're really defining the in scope, out of scope, and gathering these requirements. So with that being said, I'm going to move into our next. This updated our project timeline. This is a pretty massive addition of work. We're almost doubling the amount of users and individuals that we support in this system. So it did have basically about a 6-month impact to our project timeline. So the project we are currently in, how we have this broken out is the project is lined up in 6 different phases. Currently, right now, we're in that design, build, and configuration phase, but we do take an agile approach to this project. We are also working actively in testing items for stabilization and certification. So we're kind of doing things in all of these different sectors other than closeout. We're working simultaneously, but right now, if you were really to ask me where we are defined in the project, it's really this design, build, and configuration. So the biggest update that you'll notice is we originally had a November of 2022 go live date. That is now a May 2023. Right now, tentatively in our schedule, that's May 17th of 2023. So that's when we're looking to kind of finish the work out and bring the system live. So just wanted to kind of let you all know what that looked like. I also wanted to point out, because I get a lot of questions about, okay, we go live, well, why wouldn't the project close out? Why does the project close out a year later? Some of the requirements for us to use that federal match money is that we have to stabilize and certify the system post go live. So there is about a 9-month process to stabilize and certify the system with CMS. Once we get that basically approval and CMS awards us that certification, it's called Streamline Modular Certification, then we can move into full closeout of the project. So I just wanted to highlight that because I have had a few questions on that. Next, I wanted to give just a quick relevant project status update. As far as budget, again, we just got our IAPD. That's the document that we send to CMS to get our federal funding for the project. We just got our contract amendments and that budget document back from CMS, and I am happy to share that 98.9% will be supported by our federal share for all 3 of those contract amendments that I had spoke about earlier. So that's very, very exciting. So now we're in the process of rebaselining our budget to be inclusive of that extended time frame that we have for the project. We are currently at this time 65% complete with the project, or that's where we need to be, is at a 65, and we are coming in at a 66% complete. So we're just a tiny bit ahead of where we should be. As far as that design, build, and configuration phase that I talked about, where we're gathering all of our requirements, we are building the system the way the division needs it to be built, we are at 77% complete. And then, as I mentioned, we have kicked off all of our meetings to gather that additional requirements needed to add all of those additional programs mentioned earlier. We are in a little bit of a resource. This is, I'm sure, not a shock to most people, because I know this is globally pretty much everywhere. We are having a little bit of a resource issue with FEI, but we're actively working on additional subcontractors and the use of additional resources offshore to keep us on schedule. But there's just been, in the IT world, a lot of flux, no different than in the healthcare world. So we are actively working to keep this resource issue under control so that we can keep on time. The next phase is, I just wanted to show you, really the only area that we are technically, quote unquote, running behind on is our testing phase. Since we had to redefine our timeline for the project, we are redoing our testing plan and then moving into some more testing once that testing plan is done. So I would say that we would be moving back into green in the testing area relatively soon. I'm not going to go over too many of those because I know there's a lot of other presenters today, but I will send these out post or send them to Heike so that it can be shared out more globally. Okay, I will go to my next slide. So just some detailed areas of accomplishments. We have a lot of things going on. Like I said, this just shows you that we are actively working on our 10 interfaces. We have 11 migrations of data that we're working on, several change requests that are being deployed, and then as far as our functional requirement documents where we're gathering our requirements, we are only 6 away from being complete on that to having all the requirements gathered for the system. So what's coming next? The walkthrough demos. Really excited to share that we have a platform now that we can share all of those walkthrough demonstrations of how the system is being configured. I'm actively working with Heike, and we should in the next couple weeks have those out and posted in Relias for you all to go through. So we'll be posting the one that was done in November of 2021, and then the one that we most recently did January 12th of 2022. And we'll continue to make sure that those are infused in that system and you have direct access. Have a heavy focus on finishing our requirements and configuration, especially right now. We are heavily focused on billing and claims and on our the ISP, finishing out the ISP. Things to be coming as well as webinars to understand what is a functionality moving to connection. I know a lot of folks have questions about, okay, this is where I currently do it. Is it going to be done in connection? Where's that going to look? What's that going to feel like? So I'll be doing some webinars to kind of break that down to give you guys a better understanding of what functionality and what items will be supported in connection. We are actively working on the training plan and strategy that we'll use for training for this project. I will just tell you up front, it is a train the trainer. That is the strategy, the kind of overarching strategy we have for that. We are working on user acceptance testing. We are in the process of doing many UAT cycles with our subject matter experts in the project, but then we are in the next phase of planning user acceptance testing that is more formal, that will include providers and service coordinators and all kinds of other folks. We're working on planning our pilot billing and claims. So we've been working with MARF and MACDDS to identify some providers that can help support us in this billing and claims pilot. And then we'll be working and reaching out to all provider groups to see whether, you want to batch in your claims into connection, or if you're going to manually enter, because there will now be the expectation of either batching in your claims to connection, or you'll manually enter, you'll do your manually logging of your claims into connection. And then we'll be working on making sure that we have a comprehensive list of anybody that does not have state active directory access at this time, that would need access to connection, because that is the first step in getting access to connection, is having your state active directory. So that is kind of another big step that we have coming. For questions or concerns, you know that you can reach out to me. I've listed my contact information, and then we did just do some updates to our connection webpage that have kind of the comprehensive updates that we've shared here. So with that, I will pause and take any questions that might have come in, or if anybody wants to ask anything, I'd be happy to address that.
Toy, someone's asked, do any of these stages include the ability for connection in outside systems like SetWorks or TheraP to talk to each other?
So I'm going to assume when you mean by talk to each other that you would build an interface. The only type of interfacing that we're building at the current time for those type of connections is truly for claims, to send over your claims and do the billing piece. There is no interface in the implementation that will have anything more than billing and claims being kind of sent over. There is some crossover, and I just wanted to maybe, and this might help clarify, we are working on the LEAP grant project, and a lot of the LEAP grant project really looks at that interoperability of sending elements that we document or that are documented in the case management system back over to the provider in their electronic system. So that is a side project they're working on, but that will not be active or live at the time of implementation. So I just wanted to clarify, but that is something we're actively working towards.
Okay, thanks. Another question. Will TCM agencies still have the ability to use their own templates for their ISP, or will we all transition to using Connection?
You will all transition to using Connection.
All right, and I am scrolling to make sure I didn't miss any others.
The one thing I didn't have it on the list, but I will kind of just briefly mention, we are looking at the options for ISP migration right now. It's a really, really difficult topic in this project, and one that doesn't really have a lot of great solutions, but we're trying to work through at the division level to see what we can integrate, or if there is a kind of basically a timeline where providers have to go into the system, into Connection, kind of upload the ISP or document the ISP in Connection. We're looking at the best way to handle it. It's a very, very complex task. So right now we're working with FEI to identify the options and really find the best option. I will be just transparent because I believe in transparency. There's not a lot of great options. It's going to be a lot of work, whatever result we're in, but we're really looking at what is the best for data integrity, what is the best to make sure that we have the most functionality and that the person has the most information in the system when we go live. So more to come on that. We're just really right now diving into the technical pieces of how do we get that initial service plan in, or the ISP, those service authorizations and those initial things in the system, and make it really as seamless of an experience as possible, and also make it not as much of a manual entry thing as possible. So we are working on that. I will just be transparent with you. It's a complex piece, but we'll come back more when we have more decisions and more information to share on that.
Okay, I think that is all the questions that we received today. So thank you very much.
So thank you, everybody.
And
we'll reach out if you have anything.
All right, and Angie, it is you.
Good. Can you hear me?
Yes.
Oh, good. Okay, so I have just a couple of quick updates. We did receive from CMS a partial approval on our HCBS spend plan. So we had received a partial approval before to be able to draw down the money, and now we're receiving partial approval to be able to start moving on some of our projects. So we received that on February 7th, and we did have a robust conversation with them just this Wednesday on the 16th about the spend plan. And so basically the partial approval indicates that we can begin to implement any activity in the spend plan as long as we have not identified the activity, or as long as they don't have, as long as CMS has not identified it as a not approvable, or if they've asked for additional information about the activity. And so when we dig through the letter, there was really just 3 points where they had questions. Nothing was identified as not approvable at this point. There are 3 points where they wanted additional information, was in regards to a section where we had funding for technical assistant contracts and staff administration associated with the projects that were included in the enhanced spend plan. And we explained to them during our conversation that that was like an example of that would be for additional, technical assistance and contracting to help us continue with our health IT data interoperability. That is not something that we can do on our own. The other one was they wanted to know additional information on the EVV initiative. And so we talked to them about that and how that initiative really incentivizes providers with their system connection, connections connecting to the state's EVV aggregator. And then one that was more of a broad question from them was, under each of our activity functions within our proposed spend plan, anywhere that we indicated that we're still in the planning phase or have not finalized details, they want us to update those descriptions of the initiatives as we finalize those activities, and then to also just confirm that we're using enhanced FMAP funds. So examples of those are the details of the workforce recruitment and support, data exchanges of screening and assessment data, provider services review. And so those are all components that we are fleshing out more, especially with the governor's recommendations, that we'll be able to provide them the more detailed language now as we have that. So we will be working on that to submit to CMS. So we were really excited to finally have that approval and to be able to talk to them more about the details. And then finally, as far as the budget, as you know, we've presented to the House our budget. It looks like we are tentatively set to present to the Senate on the 23rd, so just next Wednesday. So we're looking forward to and prepping for that. And then the emergency supplemental that was voted, that was reported from the Senate Appropriations Committee to the Senate floor. So we anxiously await movement there. And that is what I have for today. So I will pass it along to Emily. Thank you.
Hi, good morning. First thing that I wanted to announce is that our DD manual, our updated one, was approved and it is published. It's out on MoHealthNet's website as well as on the DD's website, a link to get to it. So Heike, I think I put that information in the agenda. If you could post it in the chat for everybody in case you need those links. We also sent out a blast this morning with those links, an email blast. And then I think the only other thing that I wanted to give an update is as we are working through our MoKids and Partnership for Hope renewal process, which will renew July of 2023, we started with our stakeholder input, and we have concluded that portion of the renewal process. The stakeholder input is a requirement from CMS to get your families, individuals, providers, all of the stakeholders for a waiver, get their feedback on possible changes that can be made, improvements, that sort of thing. That information has been collected. We've reviewed the feedback that we've received for those waivers and discussing internally, and then we'll take items to CMS for approval, or those that we decide to make changes on. I think that's all I have, so I am going to pass it off to Leslie if you have anything today.
Yeah, thank you, Emily. I sure do. I have quite a bit, so I'll try not to take up too much time, but there's just a lot of exciting things to share that we have going on. So I'm going to share my screen. Hang on a second here. I'm a little slow. Okay. So hopefully you can see my screen, and I will get my thing here. Okay. Anyway, I'm very happy to be joining you this morning. I'm Leslie DeGroat, your division's clinical coordinator, and I wanted to let you know about a webinar that can be found on our website related to resources to help navigate through COVID. It has details on how to utilize StationMD as a resource. You know, we talk a lot about it and it seems a little overwhelming maybe to some just because it's new. So this will hopefully help break down how you can access it and use this great service. I just want I want to make sure I can let as many people as I can know how easily it really can be to get started using this service, especially since, you know, the emergency departments are often crowded, especially during this pandemic, as well as urgent cares. And perhaps the person's health need is not necessarily an emergency, but that person that maybe can't wait until their next primary care provider appointment or when they can get in. As Dr. Trevetti said earlier, you can utilize this resource to consult with a physician. You can do this in the comfort of your own home and not have to wait in the ER for hours or get out and wait at urgent care. StationMD can also come in handy at any hour, 24 hours a day, 7 days a week. You can see the webinar recording, look at my PowerPoint slides, and also a document that helps you understand how StationMD can help anyone receiving waivered services. And right here, what you're seeing is the link which we'll drop into the chat to get to the webinar page. And right here is recorded presentation, transcripts, and then this is a resource sheet right here that you can be sure to look at if you're interested. As I said, I tried to simplify it because I know that new things and using technology in areas where you maybe haven't used them before can seem overwhelming and complicated. So we're going to drop that link into the chat. So I'm going to scroll down here. And I'm going to pull up the page that is posted. This kind of tells you when, kind of when it would be appropriate to use StationMD. If you have any urgent medical issues such as fever, cough, tiredness, sore throat, runny nose, loss of taste or smell, headache, moderate pains, minor behavioral issues, seasonal infections, non-urgent issues like medication refills, constipation, routine check-ins or referrals, diagnostic referrals. And then also we have this caveat, when is it better to call 911? Because this shouldn't replace any kind of emergency service. So, if someone's having, and then right here it says, how do you sign up for StationMD? Directly contact StationMD as the need for health assessment coordination arises. Call your support coordinator and request this service to be included in your ISP. And I believe Emily dropped in this link in the chat right here that has that form that the service coordinator can utilize to submit to get that added to their ISP. Scrolling down. Okay, I have another thing I want to show you here. And this is a link that we'll drop in the chat, and you will also see this, and it breaks it down in the webinar I just talked about, and it tells you just step by step how to contact StationMD, and you can even download the app and practice using it, so that way you're more comfortable using it when you need to. They have scheduled times where you can practice, or if you need a training outside of it, you can always send StationMD an email. So I just wanted to point that out to you all. COVID testing also on the webinar. It also has information on a COVID PCR testing option that provider agencies can utilize. That has a webinar link also, and you can review and see if it is right for testing for your agency. It's an option for free PCR COVID testing. And we will put that link in the chat, and I'll show you what it's Midwest Coordinating Center. And if you're interested, you can go in and watch a webinar and see if that'll work for you. You can contact the director, and she'll have her team reach out to you and figure out if it's a good option for testing for your agency. Another thing I want to bring up to you all that as a resource that you can utilize, since I mentioned Observe, Decide, Act informational pages earlier, I want to show you the link of what those look like. So we'll drop that in the chat. But if you're needing any health information on different topics, this is for everyone. And you can click on them and print them out, share with people to educate on it, just to see what these are for. Is the purpose is to educate on how to identify or observe for signs and symptoms of the health issue, decide if you have those risk factors associated, and then how you can act upon them to keep yourselves healthy. And as I said, you can print them off and use them for education for everyone. We'll get that link dropped into the chat. We're currently working on an Observe, Decide, Act for oral health importance, accessing dental care, how to navigate through funding for dental services. So we'll stay tuned for more information on that. I want to remind everyone for COVID testing resources, I think this is the Department of Health and Senior Services, they have free testing options. So if you're in need of free testing, don't hesitate to click on here and just see what you can get for yourselves. It gives all kinds of different options. So I just wanted to remind you guys of that resource. Another exciting thing that I want to talk about is an upcoming conference just for people interested in aging with developmental disabilities. It's the Association on Aging with Developmental Disabilities annual conference. It's held on May 23rd and 24th in St. Charles, Missouri. You can attend in person or virtually. And I'm going to show you their webpage and then the conference brochure. And this is super exciting. Our division director, Jessica Bax, will be the opening keynote speaker. Our division, we have a vested interest in supporting people while they age and in making enhancements to how we support people. and we have been working closely with the Association on Aging with DD for quite some time now. So this is really an excellent opportunity for learning about aging with DD and supports that are out there and what to expect. You can see the keynote speakers we have coming up. This is also a good opportunity to make connections with other people. And at the in-person conference, they will have vendors who can show you like different products that may help people as they age, like assistive technology that can assist with medication dispensing, you know, for example. So I'm going to stop sharing. Hang on a second here. So in closing, if there's ever a health educational topic that you're interested in or anything like that, please don't hesitate to reach out. Thank you so much for your time today and have a nice weekend. And I will now hand off to our Deputy Director of Community Operations, Wendy Witzig.
So if you're talking, Wendy, we can't hear you.
No, it took me more than a minute to find my unmute button. Thank you. But at least this time I didn't start talking. I realized I was still on mute. So that's progress, right?
Exactly.
All right. Good morning, everybody. I just have a couple items and then we'll wrap up. So maybe give you a little bit of time back in your day. Wanted to bring to everybody's attention that effective April 1, we will be going back to in-person monitoring for support coordination, just with the reduced prevalence of COVID-19 and the availability of vaccinations. We believe that by April 1st, we will be totally safe to do that. And this should give all of our partners enough time to think through any technicalities that they need to take care of in order to make that transition happen. If you are comfortable in transitioning sooner, you certainly can, but certainly by April 1st, we expect all support coordination and our monitoring components to be back to in-person monitoring. And then for those of you who are following any information on the Commission of Autism Spectrum Disorders that was put into effect into statute last year. They had their first meeting that was on January 27th, and they have several priorities that they will be addressing over the coming years, but what they're going to be focusing on this year is the transition to adulthood. And they've formed 2 work groups to address issues in this priority area. One is to identify resources and identify unmet needs, and the other is around best practices and recommendations. So they meet quarterly, and there will be quarterly updates on the discussions and the progress that they make in their meetings, so you can stay tuned for that. And the next meeting will be on April 28th of this year. So just look forward to more information coming out on that. One other thing that I will mention quickly is that if you have been hearing about an apprenticeship program that the division is working on with workforce development, that continues to progress very nicely. We are partnering with the National Association of Direct Care Professionals to include curriculum that they endorse and have developed as a part of their credentialing practice as well. And we will be building that more into our Relias platform. And Heike, I know you may have more information on that. If there's information in addition to what I shared that you'd like to share with people, I will pause for you to do that.
I don't think I have anything in addition to that. I do know we have several meetings coming up that we'll be working to get more details going out on that. So there is a webinar next week, though, that will provide an overview of our Relias content portal. That's a self-registration portal. So I will put that link in the chat.
All right. And I see one question here from Max. What if a family will not do in-person meetings due to COVID-19? If someone, and the guidance will cover this, it will be coming out today. So, but it's not really changing drastically from what's up there. It's just how to go about your visits remains the same. It's just really announcing the April 1 deadline, so that will be out there. But the guidance that's up there today does say that if someone in the home has COVID-19, it is justifiable to do a virtual visit. So that is fine. If you have families that are just nervous about getting out, allowing people in or doing face-to-face just as a transition, but there's no COVID, no one has COVID or is exposed, you just need to be working with that family and individual. You need to absolutely do a virtual visit where you can see the individual and make sure that everything is good, but just working with that family to get over that fear. We have a risk of isolation setting in. It's been a long time since we've been doing in-person visits, and it's important for us to help people to get back to their normal rhythm of life to the extent possible, and that is safe to do that. So if you have trouble working with the family or trying to identify some solutions or concerned about your compliance, please reach out to your TCM TAC at your local regional office, and they will help you problem solve, along with provider relations can help work on the provider side as well. So any other questions that have come out there? Max, I hope that that answers your question there. I don't see any other questions in the chat, Heike. So with that, I think we can wish everybody a wonderful weekend. If you're off Monday for the state holiday, enjoy your extra day off. Everybody have a safe weekend out there in this crazy weather. Bye-bye.